Hello, everyone. This is David Ballantyne from the Oregon Health Authority. You're at the Member Engagement and Outreach Committee meeting for April, not yet, March. And we're going to get started here in a few minutes, so just hang tight. I am going to go through and unmute people, and we'll let you guys self-regulate your muting and et cetera. So just be aware, if you start to hear noise, you might check your own mute. And thanks for being here. Hey everyone, this is David from the Oregon Health Authority. Just a reminder, we're going to get started in just a few minutes, but I am going through and unmuting everybody, so be aware that you'll be needing to monitor your own muting just to make sure we don't go out background noise. Thanks a bunch.
Good afternoon, everybody. Welcome to the March Member Engagement and Outreach Committee meeting. I want to do a quick sound check and make sure that everybody can hear me. If someone can just say yes, no.
I can hear you, Daisha. This is Dana.
Oh, perfect. I love it when things work. Since we're 5 after, I think we can probably go ahead and get started. It doesn't look like anybody has jumped on in the last few seconds. Did everybody have an opportunity to pull the agenda from the website? It looks like David's sharing that. If you don't have it, And for those of you that were able to review, are there any other agenda items that you would like to have added? Okay, hearing nothing, we can dive right in. It looks like first up is going to be David with OHA updates.
Okay, hello and good afternoon, everybody. So I think I might ask Tiffany too if she has any updates for OHA stuff that she can pipe in that aren't covered in the other agenda items. But I think for me, the main one I wanted to talk about really ties into integrated eligibility and kind of repeat a little bit what was said at All Plan System Technical for folks that may not have been there. Well, we have we're 6 weeks into the final wave of implementation of the new One system for ODHS staff. So it's been quite an undertaking, and things are starting to move along. There's a couple of pieces about it I want to make sure folks have an understanding. It looks like the last couple of weeks we have seen a dip in call volumes call wait times. The average wait for a couple of sections have hit 12 minutes and then 16 minutes. There's still some maximum wait times you can see here of 50 minutes and 40 minutes. And so it's important to know that a member may still experience a longer than average wait time. But again, those are outliers. I think one of the facts that's missing off of this is that you don't know how many calls waited that long. So most of the time what they do is they look at that and they see that those are really a low number of people who have to wait that long. Still not the target that they want and not what they're looking for long term. So you can see this kind of trending down. I imagine as staff become more efficient and proficient in the system, that they're able to move through some of those calls a little bit more. There's another stat I wanted to share with you folks around tasks, overall productivity, and that's tasks received versus tasks processed. And one of the biggest benchmarks for success with each wave has been looking at these to say, are we ending up in a position soon where we're processing more tasks than we receive per day? So we're not exacerbating any backlogs or creating longer wait times for turnarounds for members who are working on getting access to benefits. So you see a couple signs. First of all, they've been neck and neck for most of this week, right? And then just on March 12th, you can see that they were starting to process more than they received. Again, that's a low point in the week overall, but it's still nice to see. And then you can see overall this is where they're at. So this is something I think is a pretty good metric to watch and a good sign of moving through the work that they have. They're still prioritizing work in prioritizing people who are newly applying, who don't have benefits, or we're responding to information requests that we've made that don't have benefits, and processing that work first before they move on to other priorities. And as they work through these new bodies and new programs. A quick reminder that lots of staff who are involved in this are probably, majority are learning something new besides the new system. Most of them are learning a new program. So if they were primarily medical application processors, they're also probably learning SNAP benefits, and they're learning TANF cash benefits, and vice versa. So it's a big undertaking. I think all in all, it's trucking right along at a pretty good clip. But we're going to keep an eye on it and make sure that there's nothing anything unusual happening that we need to report right away. I will kind of follow up on something that was brought up this morning. There was a discussion around duplicate primes. It was brought up in All Plan, and I probably share, duplicate primes can cause members some issues more on the technical side as far as claims and having a different medical ID. But we're working on that to see what that issue could be. Most likely, this is probably worker-driven. There's a process called member match when a worker is looking up, when they're helping a person to make sure they've got the right Oregonian. If they can't find the right person, they could start a new profile, which would create a new medical ID number or a prime. And so that's an area of opportunity to make sure that people are doing full research But most likely that's probably what's happening here, but I'm going to follow up with that probably next month in both Allplan and Yuck. So and I'll pause right there and see if there's any questions. Okay, looks like none. I see Tiffany sent me a message saying she doesn't have any additional OHA updates. So I'll move on maybe to the next portion of our agenda. Daisha, is that right? Keep trucking.
Yeah, that's good for me.
Okay, and again, as always, if anyone has a question later, they can always let me know, and we can go from there. So this was a submitted request to talk through what managed care entities are doing in regards to texting and emailing members. We kind of touched briefly on this last month when we were talking with Sarah Wiley around the smoking cessation work that she's working on. But I wanted to stop and have this conversation a little bit more broadly. You know, is this something that your organization is currently doing? Are you texting or emailing members? If you are, you know, is there a certain technology you're using? Is it permission-based? Do you talk to the member and say, you know, yes, this is something they want, and you work on it from there? Some of our questions when we're putting the agenda together is, are there requirements required by OHA to actually do that? I'll let Tiffany kind of maybe talk to that in a second. But also, can the 834 provide email addresses in the future? Maybe we'll work backwards through this a little bit too. We did some research on the 834, and it is capable of sending the email address to Emma Maria. It looks like that portion was created at a certain point. I think the interface issue is more, is that information being confidently and regularly put into the new one system, and is it being sent to us after that? So the answer to that is still kind of unknown. We're in the process of researching that, but as of now, we are not providing, the Royal We of the State is not providing the entities with this information. So I'd even be interested to know, you know, how you gather this information. Is it just based on contact with members, et cetera? Maybe I'll pause there and then open up to the group if anyone has some experience with this.
This is Maria from Cascade Health Alliance, and we've been texting members for almost over 2 years now. Some of the process that we do for that is, it depends if there's a two-way conversation that the member is choosing to have. There's an enrollment process where they opt in through two different resources. One, they have to text back agree, and two, they have to click on the link that takes them to the informed consent. These are compliance things that we have set up. But if it's simple health education information, then they're sent a welcome message at the very beginning where they have the opportunity to text back stop, which is a hard opt-out, so they no longer receive any messages. Part of the compliance behind the text that we send is every single message that goes out, unless they've already they're opted in to two-way text, is we always include that compliance text stop to opt out or help for help. And so members can have the opportunity to opt out at any time. Permissions based is simply if it's a two-way text, so they're looking to have a conversation with a case manager or a care coordinator on some of their needs, then that would require the two compliance opt-ins, which they're sent a link where it's an informed consent page. They have to click on the link, and part of in the informed consent language is to reply back agree. And if they reply back agree, they're opted in. They also have the opportunity to opt out at any time, just simply texting back the program stop. For emails, our care coordinators and case managers have been very interested in wanting to email members. It's against our policy to do so, but it would be of interest there for helping send resources if there's certain events that are going on and that our care coordinators or case managers think it's appropriate for a member to attend, they would love to be able to send that information via email to a member. The way we've helped them be able to distribute resources like that is through that two-way text. They call the member, they get their 2 informed consent enrollments, and then they're able to text a link to the member about a certain event or a food pantry that's having a special thing going on. So that's what we're currently doing. We are in hopes that we will implement emailing members, simply just for accessing resources, not for any distribution of PHI or any link towards that, but just being able to give send out resources that are open and available.
That's great. One of the questions that popped into my mind is, do you have an idea of the success or click-through rate, of some of those text messages? Are you able to gauge that through some sort of stat?
Yeah. So we measure it based on their eligibility. So just general OHP eligibility, we have a fairly high click-through rate of 11+%. And that goes to all of our members. We have 10,000 members that are opted into, or 12,000 plus members that are opted into the text message system with a click-through rate of around 11 to 12.7% each message. For the dual specific, so members eligible for both Medicaid and Medicare, we see a higher click-through and engagement rate of around anywhere from that 12% to at most 16 at one time. And then opt-out rates, so that's another engagement metric that we measure. Opt-out rates, dependent on the message, are less than 1%.
Interesting. Thank you so much for that information. That was a wealth of information. I really enjoyed hearing that. Are there any follow-up questions for Cascade Health Alliance or another managed care entity that wants to kind of talk through their process?
David, this is Dana with Willamette Dental, and I know that we use an organization to send reminder notices and that sort of thing to our members who have opted in to use text. And I guess one question I would have for CHA or others is, I mean, presumably you have to have the member opt in with a phone number, because otherwise, are you assuming that the phone number that they're giving you is able to receive text? Are there people that still just have landlines? Or is there an option to include both a landline and a cell phone so that you know which ones you're using for text?
Yeah, so we only send text messages to cell phones. The vendor that we work with has a high confidence system that eliminates all landlines from outreach. And if we do send a text to a landline, it does get reported back that it's a landline and it was undelivered and unsuccessful.
Perfect. Good to know. Thanks.
Okay. Well, if there is no other questions or comments on this piece, I would love to hear too if there's anyone. Let's see, I've got a question here in the chat. Yeah, this is a great question from Joelle. Joelle wonders, does a member incur costs for incoming or outgoing text messages? I know that's a warning sometimes you get. The data rates apply. I can't quite think of the full phrase, but good question from Joelle. Can you speak to that?
Yeah, no data rates apply to any members that we're sending text messages to, and that's what part of our welcome series message informs them on that. just so they know like all these text messages are free.
Hi, this is Steve at Care Oregon. I can't really speak closely to what the others were said about their process. I think ours are quite similar, but that's not my my expertise. But I did have a question from someone on our team that wanted me to relay to OHA about. So when we do send texts out to our members, and wondering if it would be okay to send out messages about vaccines to the members, and also is OHA going to be using text messaging for vaccine engagement?
This is Tiffany. I don't know off the top of my head about vaccine engagement with text messages. I know that there's a couple new tools that public health and their vendors have been working on to ensure that folks have updates when it's their time to get vaccinated and things. And so that's all kind of external to our work, but I can check in to see what those tools are and kind of what that process is for them for public health. But as far as like just OHP general information, we do not anticipate being able to send text messages directly for a while, just because of our system implementation.
Great, thanks, Tiffany. I guess my other question is, if we were to build messaging about vaccines and wanted to text those, would we need to? I'm imagining we would need to send that through you for OHA approval for communication.
That's a great question. Yeah, actually that, and just in general, so if it comes to like a mass text or a mass email, that's really something that you throw through the materials review process, and we would approve that way. Some of the like one-on-one kind of conversations, that's nothing we need to look at, but just ensuring that folks are in general following HIPAA, privacy laws, and federal regulations around the Telephone Consumer Protection Act. You guys all know that, but just saying it out loud. So we have no problem with texting or emailing. We think it's awesome as long as you guys are doing it according to the guidelines. And we're happy to look at those and try to turn them around as fast as possible.
Awesome, thank you.
You're welcome.
This is Danae with IHN, and we're not currently texting or emailing our members, but we have had questions from internally about the ability to email and whether or not that information can at some point be provided by OHA. The members' email addresses, if they're input on the one system or on paper applications when the members are initially applying, to use that form of communication for obviously non-PHI communications, but just as another avenue. As not all of our members do have access to phones on a regular basis, but they might have internet through computers or community resources. And that's one avenue that we want to begin exploring.
David, did you want to jump in and chat about what you kind of talked about earlier? I know that's something we definitely are looking into, being able to pull from the one system into MMIS and ensure that that email address is on the 834 so you all have it. It sounds like current email addresses we have in our system are a little outdated. They haven't been updated from one yet. So I think that's a component that's getting worked out.
Yeah, it would say that's I'll call that a work in progress. I know at one point we had done some data. We called it a data dump, which isn't really elegant, but we had taken as many email addresses that had been reported and put them into MMIS, which then triggered the 834 to add that information. But that connectivity from one and IE into MMIS has not been reestablished with the new system. So I'm kind of in the middle of conversations with both parties on that to say, what's the likelihood of that? Why is or isn't it? And those meetings are forthcoming. So I don't have any other information. because that would be a great moment or a great way, to kind of get this restarted. I think it's a good moment to do it too. If I think back on our technological steps that we've taken, in 2013, 2014, and 15, when our last kind of eligibility technology was being introduced, I still think that in many ways the texting and reliable emails communication was still kind of in its cultural infancy as far as acceptance. We're so much further down that pathway now that it seems like it should just be old hat. So I think it's a good moment to try and say, hey, let's see if we can do this. We'll also be relying on that confirmation of that information through the folks at ODHS. And so, it's another one of those data points to have validated before sending any information that could be perceived as, having HIPAA implications. It sounds like from what everyone's talking about, it's really about getting out generalized information to people who are interested, which is great. When you think we talk about secure messaging, it kind of gets really sticky really fast. So I think so. That's kind of where we're at with that piece.
That was some really great content. Any other questions around texting and emailing for members? Hearing none. We're actually pretty close to agenda times today. It looks like jumping into agenda item number 4, how-to videos. And this is coming to us, it looks like from IHN.
Hi, yeah, this is Danae at IHN, and I don't have anything to show as we're still in the, infancy stage of this project. But it was brought to us by one of our local advisory committees as a suggestion that we might look at creating short 60 to 90-second videos on a variety of topics that are typically within the member handbook, but that might be available in a audiovisual format available through our website for members that might not read the handbook or understand the handbook well, or who just might need to see it in a different way. And so we've been gathering suggestions at all 3 of our local advisories. We have 3 counties that we work with, which Lynn, Lincoln, and Benton. And the goal, I believe, is this year is to get two or 3 videos completed and up. And so that's created through the marketing, or recorded and then created through arts and visualization through the marketing process. And a couple of the video suggested topics are how does the dual eligibility work? As IHN, we have both IHN CCO and Samaritan Advantage Health Plan housed within the same building. So we have our DSNP at IHN CCO. So how that works together and how those coverages combine. Individual coverage for vision, as I know that that's a really confusing one for a lot of members because there's a lot of technical pieces to that. Behavioral health coverage, how to find a provider, why to have a PCP and see them regularly, how to understand an NOABD, which I know is another hot topic for a lot of our members because there's a lot of legalese. And I understand that there's an NOABD work group happening right now, so we're not actually moving forward with that one until after that work group is complete and we can see the finalized version of the new NOABDs. How to file an appeal, and then traditional health workers and everything about them, who they are, what they do, why to have one, can you have more than one, and just to help members understand more about them since they've been around for a little while, but they're still pretty confusing to a lot of members. So we're just trying to find different avenues to reach our members and to help them understand the benefits that they have through both OHP and in addition with IHN.
And this is David B. I wanted to pop in too, because this idea that I heard you were working on came to me from the community partner team and the ombuds team on the OHA side, and I really wanted to bring it forward because this is another way of communicating with members and it kind of ties really nicely to texting and emailing, but what are the other ways that we can speak to Oregonians that can really help them understand? So I was really fascinated to hear just now that you're pulling a lot of this information from the guidebooks, because that kind of hits on one of the things around requirements. Do we need to get involved? Do we not? Similarly to the texting and emailing messages. So that's very, I'll be really excited to see how this goes and what kind of videos you guys create. Can you tell me about hosting? Is this something that you're going to have a YouTube channel and then embed these on your website or social media? What are your thoughts on that?
I cannot speak to that, as that is not my area of expertise. I know that the desire is to have them hosted on our website in some way, shape, or form, whether that's through a YouTube channel or what the platform is, I'm not sure. Currently, we have an audio format of our members' rights and responsibilities that's just attached to our website, and that one's working, but I understand that the video format is quite a bit bigger and more dense of a file, so that might not be the best way to have it on the website, but I am not sure what marketing is working on back there behind the scenes. They're the gurus with that.
Okay, great, thank you. I would also open it up to, are there any other plans that have how-to videos or kind of basic instructional videos, or utilize video formats in any other way?
Hey, this is Dana Mitch Nelson, one of the account representatives for the CCOs. I had a question for Danae, actually. I was wondering, Danae, if you have some way of measuring the metric of engagement or understanding of those different topic areas that you're creating videos for, and if so, if you'd be willing to share some of those metrics that you're looking at as a way to benchmark member understanding.
So the first route that was taken was to go to our local advisories and speak to the members there. We've been to all three of them and gathered these ideas from them. We do have Sharissa on our transformation team is going to be looking at both appeals and grievances data and customer service calls to see if there's a correlation between what's addressed in either of those topic-wise, to see what's being asked about in customer service, what's not understood, what are members requesting assistance on, or how we can make things more clear. Because I know, especially for the vision coverage, just because there is a lot of minor details that it's hard to spell out in the member handbook and hard to put into words. So if we can get that into an audio-visual format, we might be able to clarify some of the requirements and the different benefits you get if you're pregnant, or if you just had cataract surgery, or the other situations that will allow for additional benefits. But we don't, as far as I'm aware, we don't have any of that specific metric data back yet. I know that Trista is working on that.
Great, thank you. It sounds like a really cool project. I wish you the best of luck. I think it's really important to make sure that we're targeting people in a lot of different mediums, because, especially when you're recovering from a medical incident, you may not necessarily want to sit around and read a guidebook full of information.
Yeah.
And I think, this is David B. I think it's another great time to really look at this kind of stuff. I think about the last year of my life and how many things I've digested in an auditory way, whether it's, listening to a video, a how-to video, or having something on like that in the background while I'm cooking or cleaning or whatever I'm doing in my life. I've just really changed some different ways I've been digesting material. And, I agree that this could be another step to kind of sidestep some of the legalese that kind of can really bog people down as they're reading. And another way also to meet people where they're at. And lots of times we may have members who aren't as proficient in reading as we'd hoped, right? So this is another way to present that information to them that they may be using more frequently. So I really like this idea, and I'll be interested, Danae, to have you let us know how it's going, And if there's other organizations that are a part of it, I think that would be great to hear about. We've got a great question in the chat too, from Jacqueline, asking if these will be available in any other languages than English.
For our English non-preferred languages, we have English and Spanish. So the plan is to make these available in both of those languages, as those are our two primary languages spoken within our counties. Outside of those two languages, I don't know if there is intent to make them more widely available.
Okay, thank you so much for that. That's a great question, Jacqueline, and good to hear. Danae, thank you for that.
Hey, David.
Yes.
This is Tiffany. I just wanted to kind of jump in and just kind of wrap up the requirements kind of conversation you touched on a little bit earlier.
Absolutely.
So we chatted about this internally quite a bit, and it's come up a few times because we've had a couple other CCOs have some videos come through. I just want to put this out there. It's definitely going to be on our guidance documents that we're creating too, but we do not need to review your videos before you post them. It's totally fine. The one thing that we are hoping is folks will submit a script so we can kind of see that. And then everything else we're totally fine with. You guys just posting, making it happen, because this is such a cool project. We want to make sure that we're not being a barrier or hindrance to any of this.
Great. I'm excited to see how that comes along. Thank you so much for sharing. Any other questions, comments, feedback, or other on videos or other formats? Okay, so moving right along, it looks like we jump into updates from Tiffany on the NOABD and the NOAR template work group.
Thank you so much, Stacia. David, would you mind pulling up my PowerPoint? Thank you, sir. You can drop down to the next slide. So I have a few quick updates, and then I wanted to jump into what I'm very excited to show you all is the SharePoint redesign, which is the next agenda item. But let's talk about the notice work group. For the NOABD workshop, we actually held our first workshop yesterday. So we went through line by line in a combined version of the NOABD. We asked all plans to submit kind of their edits and comments, and then combined all those and walked through it yesterday. It went really well. We're going to follow up to do some finalization. But the goal is once we have the NOABD template and then the NOAR template ready to roll, we're going to come back as this larger work group, the NOABD work group, and approve them and move them to NEOC, and then also out for consumer member review. So I just wanted to give you guys a quick update. The next workshop is going to be scheduled for March 25th, and then we're all just putting them all together and going through them basically line by line to ensure that we're all on the same page for that basic template that we're going to work from. Any questions on the notice work group? Okay, feel free. I think we're involving everyone from your compliance department, so feel free to reach out to them if you have questions, but you're all welcome to be there at the NOAR workshop. So feel free to reach out to me too if you need that information. I'm happy to forward you the appointment. The next update I have for you is about materials review process. I just wanted to give you all a heads up that we are making progress. I am making progress on the backlog. There's still, I think I'm a couple weeks out with some expedited and regulars, but we're moving as fast as possible. So you'll be seeing some rapid fire approvals from me in the next week. We're also going to be sending out to folks who still have some older submissions that haven't been looked at for a while, those kind of obsolete things that maybe need to be archived. I'll be sending out spreadsheets to folks to just say like, hey, can you let me know what needs to be prioritized, what needs to be archived, etc. So hoping I can lean on you all for that a little bit. Then we'll clean up those folders and be able to have a little more user-friendly process. And as I said last time, please just continue to send any urgent requests or things that need to be prioritized. I'm trying to get to them as fast as possible, but just in case I miss something, feel free to reach out and let me know that something needs to be reviewed immediately, because I'm happy to do that. Any questions in general about the review process before we jump into SharePoint? Okay. David, would you mind jumping to the next slide? Actually, the next slide, thank you. So I appreciate that. I am going to show you kind of my ideas for how we're going to revamp the upload portion and then move on to the larger site. I went through and I tried to see exactly what folks would need to communicate, folks would need to have later, just in case they want to reference it back, and then what I need in order to my reviews. So I whittle it, all of the fields down, and here's half of them. So the one piece I'm going to keep in there is a summary of document, just like a 3 or 4 word summary of like, this is a, you know, an HRA a screening or something. The status, oh, sorry, David, I sent you the wrong version. The status actually has a few more on here, but the status is going to be submitted, reviewed by OHA, revised, withdrawn, file and use, and approved. So there's a couple missing from this image. I apologize for that. But it's just to get a little more granular on where the status of things are. So if, for example, I were to review something and you haven't yet picked it up, it'll be reviewed by OHA. And then if you revise something, it needs to come back revised by MCE. So we're just having a little more information on the status there, so things aren't just sitting there, or it's maybe confusing just to have the really general buckets. There'll be a spot for oh, go ahead.
Did I grab the wrong PowerPoint? I just want to be sure I could switch it out. Otherwise.
Oh no, it was just the slide, so no worries. Don't worry about it. But thank you.
Okay, cool. Okay.
The contract deliverable, I want to make sure that we have that piece. I know in the current version we have something that says required by DMAP. I don't think that's as clear, so I wanted to change it to contract deliverable, just so we can pull those into a folder or a view so you guys can see those very simply and it's not buried. So notes for you, is it marketing? How will it be shared? So those are the main pieces on this. David, would you mind going to the next slide, please? We'll have a deadline you can drop in, totally optional, but it'd be really helpful if you dropped in a deadline to let me know, like, hey, it needs to be printed by this date, so let's get this moving. So here's the other piece that I'm stoked about. The new version of the document, one of the things that we have that I've seen moving through the folders is that there's a lot of pieces that are actually older versions of documents that have already been submitted and approved. And so there's actually a lookup function in SharePoint where you can grab the ID number of a previous document and just have it load there. So that's what this little field is. It's just literally a drop down of numbers. So it's a slightly cumbersome because you have to wade through the numbers, but it is really cool because it just links that document immediately, so we can go and archive it and then see the differences between the documents. There's also just a note about language access, because I find that that's probably the thing that we talk about the most, is ensuring people either have language access or an insert. So including the insert is also a document lookup. If you have the insert that's already in there approved, you can just link it, attach it. You don't have to worry about it. And then Steve, I think you're on the line. This is the next one. Does this apply to more than one plan? So there'll be a drop down so you can choose what other plan it applies to, and then we'll have a way to pull those together so we can record them for both plans instead of just submitting a whole bunch of documents that are exactly the same, minus like logo and contact information. The
Yay.
other piece, I know, yeah, woo. The other piece I wanted to tell you before we open it for comments is just that I kind of crunched all the OHA specific review information down in one piece. Like what I would like to do is give you all a grade about readability before we start taking the exclusions out and then after, so you can kind of see the differences. And then just a quick note thing. So those are the only fields that I have in there, but I wanted to stop for a second, give you guys a chance to digest this and then see if there's any comments or things I might have forgot off the top of my head.
Looks amazing to me, Tiffany. Really great. Thank you.
Thank you. The other piece I wanted to share with this is that, and I'll talk about it a little more later, but I just want to let you all know that I'm hoping to do a kind of a pilot couple of weeks so we can get used to this, and then if it works, if there's more suggestions, more improvements, this will be a continuous process. So we'll just continue to try to improve this to make sure we are making this as efficient and user-friendly as possible.
Tiffany, does that mean there's a go live? Sorry, does that mean there's a go live date for this? Is this live? What's the deal?
There's a go live. There's phases. No, I'll talk about it in a second. It's way more simple. Unfortunately, it's not that exciting. But if you move on to the next slide, I'll show you what I'm thinking for. I think the homepage is the next slide. So here's our main homepage, I believe, is just like two little buckets with like materials, submissions, and then help documents. I'd like to make that actual views that you can pull up the documents that you care about. So review, follow-up, approved, and then have a place for if you wanted to pull your archive, your deliverables, you need a guide or a guidance document or help, have those on the left-hand nav. So that's kind of my general idea with those three buckets. Are there any other buckets that you guys would like immediate access to that you can just click through and see what's available or what's in that view or folder?
And I know this might just apply to, hi, this is Danae from IGN. This might just apply to 2020, 2021, but like along with the deliverables, OHA memos for deliverable extensions or waivers.
Oh, that's a really good idea. Okay, great. Thank you. Anything else you want to see on the homepage?
Hi, this is Steve again. So just maybe a question, would it make sense to, and I don't want to make this too unwieldy, but like a template versus a unique letter, something that we're going to be reusing versus something that's a one-off. And I apologize, I've not seen this in the member handbook, but you know, how should we be identifying that? And if we need to be identifying those separately, could we do it here potentially, or in the page prior, or does it matter to you?
Yes and yes. I think it'd be great to have that separation because a lot of times when we submit things, it's like, oh, this is just like this next version of the same templated letter. So we can have a yes or no or some kind of thing to identify that it's a template. And then, especially if it's a deliverable, like related to deliverables, like the NOABD, et cetera. But then we can also have a quick way to get to your templates if that's helpful. Are you thinking for your view to know that like, okay, here's my templates that have been approved, or are you thinking more for our review process?
Well, I mean, both would be great. If we could have access to those templates that are approved, and so we're not reinventing the wheel on our side, would be really helpful. But also just a clarity on, you know, do I need to identify, because sometimes we don't know, you know, in a perfect world, yes, we want this to be a template, but sometimes it's going to be one-off because there's really a lot of unique information in there. But it would be good for, you know, kind of you to give us that guidance. So we're really clear on it, and we're not clogging, you know, clogging it for you because there's confusion.
Absolutely, that makes complete sense to me. I am a little more clear on it now. So that that makes sense. We'll have a link out to templates that are ready for you all to use. And then also in our guidance documentation, we'll make sure that we have really clear information about what to do with a template. And in addition to that, we'll add a little yes, no kind of checkbox to see if it's a template. And so that way we can maybe pull them out if we need to at some point in the future. So we'll just have that little identifier in there as well.
Oh my goodness, that sounds so amazing. And I'm gonna ask one more question that I thought of on the last page. When it comes to the language access statement versus the 1557, and apologies again if I missed this on the contract. So if we create a postcard, we need to have the large the language access in 18-point font. If we create a letter, and we're going to put the 1557 in the envelope with the letter, do we or do we not need that language access call out on the letter as well?
I cannot remember exactly what the 1557 has on it. I think it's almost exactly the same language that we use, and then the information where you just drop in your contact info.
Yep.
So in that case, absolutely, like you would just need that insert, and you would not have to put that also on your individual letter.
Perfect. Awesome. Thank you so much.
You're very welcome. These are great questions. Anything else before I show you kind of, the next view is not that exciting, but the next view kind of has what we'll have at the top of each of the folders. Okay, David, do you want to jump to the next page, please, sir? So, so this is what will be on the top of every folder you have in every view that you're going to be working through. I'll make sure that there are quick links at the top that are very easy to, like, actually, I just want to see what's approved, follow-up where needed. The other piece is we're going to have some training and some just quick walkthroughs of how to filter, create your own specific views, and then be able to sort and stuff by all of these different column headers, so that you'll be able to find information quickly, and as much as possible, we will create that navigation to help you do so. That is it for the walkthrough of what I'm going to be doing for SharePoint to have that initial redesign. Are there any questions, comments, anything really?
Tiffany, this is Sheila.
Hey there.
Hi. So is there going to be and maybe you've already shown us this, will there be a reference document as there was at the beginning of SharePoint, so that we can, once we start using this, we can reference it just to make sure that we're loading everything correctly or uploading everything? I'm kind of referring back to, and I don't know if there's still going to be a particular naming convention with our document added at the end. Is that the plan? See, right now it just says test 1, but will it still be the particular naming convention that is currently used in SharePoint?
Those are both great questions. Thank you, Sheila. David, if you want to jump to the next slide, that'd be awesome. While I'm, yes, thank you. So first, absolutely, we're going to have guidance documents. My hope is to also have checklists, how-to videos, and some other kind of screenshot documentation of how to walk through that. That will include naming conventions. We haven't had a larger conversation about that, but my assumption is that naming conventions are not going to play a larger role like they used to, because we are using that ID number that's in SharePoint already automatically, instead of having the larger OHA / all care / whatever the documentation is / all of that cool approval number. So in my opinion, I don't think we need those naming conventions anymore, but I would love to hear from the group on that.
That could make me happier, especially trying to remember what reference number or what number you're on in order. So that, I think that would be fantastic. I don't know how everybody else feels.
This is Steve again at Care Oregon. Because we have multiple CCOs, and I think it's beneficial for us to call out our CCO in it because our designers are working on multiples. And also, I think there's some benefit to having the year on there, so you realize maybe how old something is. That's just my 2 cents.
That's good
As
feedback.
long as we don't have to, I would just say as long as we didn't have to include a document number, because the document number was getting a little crazy to track.
Yeah, I agree with that. And I also think from our perspective on our side, it's really what's going to work best for all of you, because you're like, I can see all of your folders, but you can only see your individual information. So it's really how you want to name things in there. The other thing we can do is add columns to identify like maybe different subject matters or keywords or something that you would like to use to be able to search a little better for yourself. If you have thoughts on that, please feel free to throw them my way, because I'd be happy to create more searchable and sortable columns for you all.
Thanks, Tiffany.
You are quite welcome. I
So
will
accommodating.
jump into, sometimes. I will jump into kind of next steps and then thoughts for process and procedure. So we are going to update based on feedback and then implement that redesign. And like I said before, use this for a couple weeks, basically probably a month, and then the next MEOC we'll chat about how is it working, what needs to change. And then we'll just kind of keep that on our radar. So whenever someone has a question or some thoughts for redesign, I want this to be a very collaborative process. Like I said before, it really needs to work best for all of us. So we'll just continue to have that conversation and bring it back up. The one thing I will say is my main focus is just eliminating that backlog first, and we're getting it down there, but it's going to take me probably another week or two to really move through everything. So it won't be immediate, but I think in the next month I'll be able to really overhaul and implement all of these suggestions and designs. And then for the process and procedure portion, like I said before, not only are we going to have some checklists and some information, I'm going to give you some checklists for plain language, some just best practices, just a reference if you need it, or if you need to train someone new, we'll have those. And then also the definitive list of what needs to be submitted, what can be file and use, what needs to go through the deliverable process, etc. One of the pieces I'm learning in this job is how differently we handle in quality assurance a deliverable, a contract deliverable versus just a regular document. So that process I wasn't as aware of before I came to this position. And so I'm not sure that everyone else is aware of that. So I'd like to give that a little more transparency and have everyone understand that process flow. So that'll be another piece of these documents that we're creating as well. So that's all I have for my updates. Any questions or thoughts you want to share before I give the agenda back to Daisha? Okay, thank you all so much. I really appreciate you letting me take this time.
Awesome, Tiffany. That all looks so great. And I know that I'm not just saying this for myself, but I know that we're all really, really excited about the SharePoint and the materials review happening so timely. So that takes us through the end of our written agenda items. We just kind of open it up now for roundtable or any public comment. If anybody has anything they'd like to add, share, or ask questions. Hearing nothing, it looks like we're gonna wrap up about 30 minutes early today. And then as per the usual, David will send out slides from today, and you can register for the April meeting. If you have any topics that you want to make sure are on the agenda for next month, you can email those to myself, to David, or to Dana Steeringer. Anything else, David or Dana?
No, none from me. Just a big thank you. This was a great conversation today, and I appreciate it.
Yeah, same. All
Good
right.
too. Thank you.
Okay,
Thanks,
with
everyone.
that, have a good afternoon.
Thank you.
Thank you.